At SDHC, we believe that feedback is a gift that should help someone to do things differently, change a habit or two, become more self aware, or understand what you may need to change in order to be more successful. Done well, it's a really powerful tool, so we take it seriously. Lots of people have said lots of things about feedback. We want to create an environment where both giving and receiving feedback is both normal, valued, and welcome, even if it is sometimes difficult to hear. We need to rely on each other to ensure this is always the case. The quotes appearing here highlight the importance of feedback and potential pitfalls. This is why a structure of giving feedback can be very useful, and at SDHC we expect it from everyone when necessary, which is why I decided to do this video. Like anything, providing feedback is a skill that anyone can develop. We also come back to the importance of relationships again. Successful feedback is based on trusting relationships, so I think it's an important reminder here about how we wish to value and put energy and time into our relationships with each other. There are many ways feedback can be given. The reason for this presentation is to introduce a model of feedback that we would like to use predominantly with clinicians. Again, there are several different models of feedback described, but we would like to use ALOBA because it's very much focused on the recipient. It is often an alien approach to people, hence introducing it here early on. A general principle we want to adopt at SDHC is to understand the situation as well as possible before offering opinion or advice. This applies to consulting with patients, obtaining a thorough history and examination, following up on any cues, and exploring any ideas, concerns, and expectations, and understanding the problem in the context of the individual. It also applies to feedback, and ALOBA is a useful tool developed by Silverman and colleagues to help achieve this balance. This video is intended as a very brief introduction to ALOBA and how we would like to value and conduct feedback as an organisation. As you can see, ALOBA stands for Agenda-Led Outcome-Based Analysis, and you can find out much more about it in various books and on the web. A true exploration of the learner's agenda helps us to understand the learner's take on things, so the facilitator can learn a lot here. Also, uninvited feedback will often not have the desired impact. So we need to understand what feedback is wanted and why. When done well, this will assess the degree of awareness of self-performance and ability to reflect. If other areas should be covered, explore if this could be on the agenda and seek permission. This part of the process helps the recipient reflect more deeply on their performance. Understanding the outcomes that the recipient would like from the feedback helps us to see the motivators and enables us to frame any feedback appropriately. The process of defining the outcomes will hopefully help the recipient begin to reflect on what is important to them and why. Outcomes might be things like passing the exam, consulting more efficiently with regards to time, or having a structure to deal with an angry patient. I find it useful to document the main agreed outcomes the recipient wishes to achieve so I can remember to keep coming back to them. As we've discussed, the analysis needs to examine the agreed agenda while framing feedback around the agreed outcomes. Feedback should be descriptive and specific. For example, If watching a consultation, I would write a transcription of the important parts and then read it to the recipient. This gives them the ability to think for themselves about what they might do differently. It also allows me to be very specific with the feedback. Any feedback needs to be balanced and honest, and is received better if offers and suggestions are made in a problem-solving way. We need to try to be non-judgmental, even resisting saying, "this is good" or "this was bad," because things are rarely this black and white, and we should value individualism. We can say if something is wrong or right, that's not a judgment. All feedback should be well-intentioned, valuing the recipient and supportive. We should check feedback with the recipient. Do they accept it? Would they like to challenge it? Always come back to the recipient's desired outcomes, framing feedback around these. An important role of the person feeding back is to structure and summarize the learning so a structured endpoint is reached. I'll leave you with the summary of what ALOBA stands for. I hope you recognise it in action when you seek feedback and are able to begin to use this approach yourself. We would certainly welcome your feedback around the quality and frequency of feedback that you receive to support your ongoing development.